Good afternoon, everyone. Today, I'm going to discuss a small topic regarding ECG. So, you might be knowing the full form of ECG is electrocardiogram. So, why ECG is used? What is the purpose of you using ECG machine in order to? The answer for this is in order to record the working potential of the heart. So if we define it in a small way, we can say to record the potential of the heart. Means what kind of potential? Either it may be like the working potential of the heart. So let me write it down over here in form of abbreviation in order to record the work potential of the heart. So what are all the aspects? I think you might have seen a ECG report of a patient. It usually represents the normal ECG report represents like this. This is called as P wave. This is called as Q wave. This is called as R wave. This is called as S wave, and this is called as T wave. So this is the representation of ECG pattern. So how do we define this? How do we identify? How does this patterns comes in the ECG? What are all the aspects? What are all the rules regarding why this pattern is found in ECG? So we'll be discussing the basics of ECG first, how the waves are represented in the ECG. So let me make a virtualistic representation of a heart. Consider this is the negative electrode and this is the positive electrode, and this is our heart. As I'll be not able to draw the fully picturesque of heart, so I'll be representing heart as a circle over here. So coming to the first point, so the first thing we have to learn is, suppose the negative electrode is connected to the right atrium, towards the right atrium. This is our right atrium, this is our left atrium, this is our right ventricle, this is our left ventricle. So both the electrodes are placed in an opposite way. So how do we get to know how these waves arise? If we take an example, if there is a generation of electric current from these from negative electrode, so it will pass from negative to positive. The current flows from negative to positive. So the first thing we have to remember is, whenever there is flow of electric current from negative to positive, there is a generation of elevated wave. Means, first let me write it down over here. Elevated wave means when the current flows from positive to negative, then the ECG will record the pattern as the elevated wave, like this. There will be upward deviation of the wave. So this is the first thing you have to remember. And the second thing is, when the flow of the electric current is from positive to negative, positive to negative, I'm sorry, positive to negative, we always see a depressed wave where like the wave shifts its pattern downwards. The ECG will record the wave as a depressed wave, a depressed kind of thing. So these are the two things, the basic things which we have to remember whenever we are studying about ECG. Hope you might have got this topic. So let us start with the recording of ECG, how this pattern like arises. So let me start with how P wave is generated. Generation of P wave in the ECG. So let me take the same diagram which I have drawn above over there. So this is our heart, this is the negative electrode, and this is the positive electrode. So consider this is a right atrium, left atrium, right ventricle, and left ventricle. So this is our right atrium. As you all know that our pacemaker SA node is present in right atrium. So whenever there is a generation of impulses, or whenever there is a generation of impulses from the excitable tissue, what you call it as SA node, the impulses passes from right atrium to AV node through the Bachmann's bundle. I have discussed about Bachmann's bundle in the previous lecture. So whenever the current passes from right atrium to AV node, if you take it in this form, you as I have said earlier, whenever there is a flow of electric current from negative to positive, if you parallelly see over here, the impulses are passing from negative to positive way, because the positive way is present over here, near to the left ventricle, and the negative electrode is present near to the right atrium. So there is a transfer, there is a generation of impulses from SA node, and there is a transmission of electric impulses from SA node to AV node. So if we see it in the manner of electrodes, it is the impulses are flowing from negative to positive. So we can, as I have said earlier, whenever there is a flow of electric charges from negative to positive, there is always generation of elevated wave. So the ECG machine will record like this, the elevated wave. So this is the P wave. This is the generation of P wave. So what we also call it as atrial depolarization. This is the atrial depolarization. So this is the generation of P wave. So let us go to the generation of Q wave. So if you take Q wave, so let me draw the diagram again over here. This is our heart. These are the four chambers of the heart, and this is the negative and positive electrode rods. As I said earlier, the impulses are transferred from SA node to AV node through Bachmann's bundle. Now what happens is there is a delay of transmission of impulses from AV node to ventricle for about 0.1 seconds. So whenever, as I have discussed about this in the previous class, whenever there is a delay of 0.1 seconds in the AV node, some of the impulses get transferred again to the SA node during this period. So as I have said, the impulses are transferring from AV node to SA node again, some of the impulses. So if you take it in the form of electrode specificity, the remaining impulses from AV node are passing from negative to positive way. You may see like this. The impulses are flowing from this way to this way. So this is as like as the current is passing from positive to negative. So as I have discussed earlier, whenever there is a flow of electric charges from positive to negative, there is always depressed wave form. Depressed wave. So this is our Q wave. Okay, so this is our generation of Q wave. I hope you might have got this topic. So let us go to the generation of R wave. Generation of R wave in the ECG. So let me draw the same diagram over here. These are our 4 chambers. So okay, as I have said earlier, the impulses are transferred from SA node to AV node, and there are some impulses which are again transferred to the AV node for during the period of 0.1 second. Now what happens is, after the period of 0.1 second, there is transferring of there's a transfer of impulses from AV node to the ventricles, like this, in this manner, with the help of Purkinje fibers, which are what you call it as bundle of His, which are present in the borders of the ventricles. Bundle of His. So the bundle of His helps in transferring of impulses from AV node to the ventricles. So this gets the impulses get diverted with as the bundle of his gets branched after in the border, in the completion of border of the ventricles. So it will go in this manner. I mentioned, I have drawn the arrows where the impulses are getting transferred, which helps in contraction of ventricles. So now I'll be discussing a bit of physics over here. If you take these two waves as a two vectors, as you have studied in physics, that if two vectors are going in an opposite way from the same point, the net resultant vector will be like this. This is our net resultant vector. To ease this topic, let me mention the vectors as R1 and R2. These are the two vectors. So if we take the sum of two vectors, then the resultant vector will be R3, which is passing over here. So we have to take the resultant vector, as we cannot distinguish both of the vectors which will leads to the complication of this topic. So we will be taking only the resultant vector. So this is the resultant vector which is passing over here in the middle. So if you see in this if you see in terms of electrodes, the resultant vector is passing from negative to positive. The resultant vector is passing from negative to positive. So as I have discussed earlier, whenever there is a flow of electric charges from negative to positive, then there is always a generation of elevated wave. So let me draw the whole ECG pattern again. This is our P wave, this is our Q wave. Then after, as I have said, there is again a flow of the charges from negative to positive. Then this will arise to then an elevated wave. This is our elevated wave. This is P, this is Q, this is R wave. So this is the generation of R wave in the ECG. So like if you take about generation of S wave, I'll continue the generation of S wave here only, because both are interconnected with each other. As I have said, the impulses are getting distinguished or are divided into by two branches of bundle of phase. One is from here and one is from here. So these impulses are again transferred again towards the atrium with the help of Purkinje fibers. As you all know about Purkinje fibers, these are the most most rapid conducting fibers which helps in fast conduction of impulses. So Purkinje fibers are present over here. So mentioned where the Purkinje fibers are present. So these two the bundle of his transfers the impulses from the respective branches of Purkinje fibers. The right part the right part of bundle of his will transfer to the right part of Purkinje fibers, and the left part of bundle of his will transfer the impulses to the left part of Purkinje fibers. So this will be the flow of impulses again. So if there is a flow of impulses from positive to negative, if you see in the aspect of electrodes, the impulses are again the electric charges are again flowing from positive to negative. So you are known with the fact that the flow, if there is a flow of impulses from positive to negative, there is always generation of depressed wave. So there will be a formation of depressed wave over here. This we call it as S wave. Okay. So this was, so if you take this QRS complex, it represents the ventricular depolarization. I'm sorry. QRS complex, ventricular deep. This represents the ventricular depolarization. So coming up to the last wave, what we call it as T wave. This is as same as the generation of P wave. So like if we talk about T wave, this represents the ventricular repolarization. It represents the ventricular repolarization. So if we talk about the generation of T wave in ECG, it's as simple as the first thing. Like as I have said, the impulses get transferred from Purkinje fibers to the right atrium. Okay. Again, whenever it reaches again to the right atrium, whenever these impulses which are carried from Purkinje fibers, when they reach to the right atrium, again there will be a regeneration of P wave, because as the SA node is transferring its impulses, besides that there are some impulses which gets mixed with the generation impulses which are generated again from the SA node. So the impulses again get like if you take in if you see in the aspect of electrodes, the impulses are again passing from negative to positive. So as I have said earlier, whenever there is flow of the electric charges from negative to positive, there is always generation of elevated wave. So if I take it in an ECG manner, it will be like this T wave. So this is the generation, like this is the phenomenon by which the ECG pattern is recorded by the machine and with the activity of the heart. Okay, so these are the things which should be like which should be with you all guys, because this is one of the most important topic which helps us in interpretation of all the ECG reports. So again, like ECG, there are 3 leads used in ECG. 3 leads used in ECG. One is called as lead 1, another one is called as lead 2, and another one is called as lead 3. So there is a universal law where we can like measure the potential of the heart with the help of one rule called as Einthoven's law. This is one of the most important law used in in interpretation of Einthoven's law. So like if you take all 3 leads in a triangle manner, this is lead 1, and this is the lead this is the lead 2, and this is the lead 3. So if we add both the potential of lead 1 and lead 3, if we add the potential of lead 1 and lead 3, we'll get the net potential of lead 2, which is recorded in the ECG. So that's all which you have to remember. So again, there are a lot more topic to be discussed about ECG, about the leads, and about what are all the augmented limbs, and how they are used in ECG to interpret the ECG pattern, and which helps in the diagnosis of a patient who is suffering from any of the cardiac disease. So I hope you got this topic, and I thank you all for your attention. Goodbye. Have a nice